Hello everyone, my name is Amita and I am your host for today's session on thyroid testing. We are going to be talking with a naturopathic doctor, Dr. Suhani Shah, and she is a naturopathic doctor practicing in Canada who will be talking to us about how do you test for thyroid, what is the significance of each test, common symptoms, what are the tools for lifestyle, diet, herbs, different herbs as well, and then tools that you can use for your thyroid balance. So now we know that thyroid is more prevalent amongst women than men. So I know that women are more prone to thyroid disorders, and I'm just waiting for her to join me so that we can get started. And any questions you have, anything that you like to ask, any feedback, you are welcome to put it in your comment, and anything else that you would like to say, you are welcome to also tell us what you like to do. Now I'm waiting for her to join me. Dr. Suhani Shah, she is a naturopathic doctor who will be joining me from Canada in 1 second. So let's see. There you go. So again, the topic is thyroid testing and how naturopathy can help with thyroid. There you are. Hi there. How are you?
Hi,
Hello.
how are you?
Yes, I'm good. So I was just telling our viewers about our topic, on thyroid testing, and how naturopathy can help. So we are talking with Dr. Suhani Shah, who's joined us live from Canada. So maybe you can tell us a little bit about yourself before we go into the questions.
Yeah, so I'm a naturopathic doctor, a licensed naturopathic doctor here in Calgary, Alberta, in Canada. And I practice out of a clinic called Doctor for Moms Health Center. So I treat a lot of pregnancy, preconception, fertility, and also postpartum support in children. But I also do a lot of fertility, hormone health, and thyroid health and digestion as
Okay.
well.
Great. Well, welcome to our session. So
Thank
let's
you.
talk about the thyroid. And thyroid is more prevalent amongst women. At least I've looked at the data. I'm not a doctor. So how do you test for thyroid? Let's just talk from the basics of the testing part, and then we'll go down a bit.
Yeah. So with the testing, so usually when you go to your medical doctor and ask for a test, I don't know how it is elsewhere, but in Canada or North America, they'll test your TSH, and
Okay.
usually they say if your TSH is abnormal, then they'll go further and do other thyroid hormone testing. I like to kind of look at the full spectrum, the full thyroid panel. So that means I'm looking at TSH, but also free T3 and free T4.
Okay.
And that's just because the TSH is produced in your brain, and that tells your thyroid gland to produce T4 and T3.
So
So
it goes
often,
faster from here, and then it goes here, right? Thyroid
yeah,
gland is right here. Okay.
yeah. So the TSH will tell your thyroid gland to make
Yeah.
T4 and T3, and T3 is actually your active thyroid hormone. So
Okay.
it's what's regulating your metabolism, body temperature, and everything thyroid is supposed to do. Like often I've seen even like TSH being normal, but people having suboptimal levels of T4 or T3 because there's a lot of different factors that can affect that. So I look at that. Yeah.
So you look at
And then
TSH, T3, T4, anything else?
and then I look at just thyroid antibodies too. So your anti-TPO antibodies and your anti-thyroglobulin antibodies. And if you tend to have a little bit more of those hyperthyroid symptoms, then I'll look at TSH receptor antibodies too for Graves' disease. But that's basically ruling out like autoimmune causes of thyroid, so Hashimoto's or Graves'.
Got it. So what are the symptoms? I mean, we've heard like chronic fatigue, all kind of things, right? Stress. So why, how would people say they have thyroid? Like they will come to you and say what? And then you say, oh, I should do TSH versus T3, T4, all the things that you're talking about.
Yeah, so usually when people come, they say they have like tired all the time, or they feel like cold all the time, like cold hands and feet, cold body temperature, feeling tired. or the hair's falling out a lot.
Oh, hair fall is
And
also one of the things.
yeah, hair falling out is one of the things for low thyroid function. Um, yeah, and then people coming in with like digestive issues, like if they're feeling constipated a lot, too,
Okay.
they can be a whole bunch of digestive stuff going on, but thyroid is one of the things you want to look at for that too.
Mm-hmm.
Low blood pressure, low heart rate, even like women who like menstruating, like if their cycles are irregular, if their
Yeah.
cycles are like scanty, like not enough blood flow, or just like all over the place kind of thing, that's
Mm-hmm.
another sign to look at thyroid hormone.
Got it. And it's more prevalent amongst women. Any age group in particular? Like, is it more prevalent amongst the women who are at the menstruation age, or at the menopause age? In between, is they are spared for some reason, or is there some kind of a spectrum that we are, what you have seen at least?
I've seen, so initially when I started practicing, I saw it a lot more in older
Okay.
women, especially like postmenopausal when your estrogen and progesterone levels drop. That
Yeah.
can kind of create that thyroid issues. But
Yeah.
lately, I've been seeing a lot more thyroid issues also in like middle age, young adult
Oh, yeah.
females,
30 to
and
40,
even
30 to 40 or something like that.
yeah, and I think a lot of it also is related to stress as well because there's like nutrition components. Also, stress can affect your thyroid.
Yeah.
Um, And I'm also like, I know it's more common in females, like you said, but
Yeah.
a lot of males will have like low thyroid.
Thyroid issues as well. Yeah, no, I think we're all stressed out. I mean, what can we do? The world is full of stress right now, and all of us have to have some kind of issues, and so we need to figure out how to, bring it down. So brings us to the next one, the tools, right? The tools for remission. So since you're a naturopathic doctor, diet, lifestyle, herbs, what are your tools when you tell a patient on an overall idea? By the way, guys, this is not a medical advice. This is just a general idea that we are trying to get from Dr. Suhani Shah. So please go ahead.
Yeah, so, and if anyone has any questions, just drop them in the comment below.
Yeah.
Yeah. So with diet, I look at a lot kind of inflammatory foods. So especially if you have that like autoimmune thyroid picture, you really want to kind of reduce any inflammatory foods in your body. So any like dairy, gluten, um, nitrates like tomatoes, eggplants, potatoes,
Wow.
grains are a huge inflammatory food.
Yeah.
And then also like I do food sensitivity testing as well to kind of see what foods are triggering inflammation in the body.
Okay.
Those are big foods, but also like iron, like low iron, like can be a contributor to low thyroid hormone too. We
Okay.
want to make sure we're optimizing iron-rich food in the diet. So whether it's like either like being non-vegetarian, like eating meat, or if you're vegetarian, eating like high iron foods, pairing them with vitamin C foods. And then just making sure you're getting like a good amount of iodine containing food. So I know in North America, it's not a huge problem getting iodine from like salt,
Yeah.
but in other parts of the world, just making sure you're getting good iodine containing food. And then the one thing that is really good are Brazil nuts. Brazil nuts are high in selenium.
Brazil nuts. Brazil
Yeah.
nuts. Okay.
And they're high in selenium, which helps with that T4 to T3 conversion. Also helps with antibodies.
Okay.
Yeah.
So you'll devise sort of like a diet plan and make sure you take the inflammatory foods out, replace them with something that will nourish them, with iron-rich foods is what I'm understanding, and selenium and some of the other components that are important, right, for the thyroid gland to start getting into the normalcy.
Yeah. Kind of we'll go through like so usually in my first visit we do a whole health history, kind of look at everything that's going on because the whole body's connected and kind of see what we need to adjust with diet and like take out inflammatory foods, kind of clean up the diet.
Got it. So once you get at the diet, so now the diet is a big component, as all of us know. Then the next is, do you also use some herbs, and do you also tell them some lifestyle changes, modifications? What are the other tools that you use?
Yeah. So again, like lifestyle, making sure like physical activity is there. and also managing stress, like helping them find ways to manage stress too, especially if stress and your adrenals are a huge factor contributing to thyroid. And then we can even look at like other hormone detox. So if someone is like more estrogen dominant, that can affect their hormones too. So kind of working more on like the detox pathways.
Got it.
And another thing, and then in terms of supplements, so there's quite a few different supplements, and just a lot. So I would encourage people to work with a healthcare professional, nutritionist, naturopathic doctor to kind of make sure they're really getting the right doses and everything for them. But doing some kind of adrenal adaptogen to kind of modulate that cortisol stress hormone is important. It's something like ashwagandha.
Wow. Okay. Ashwagandha is everywhere nowadays.
Yeah. It's a really powerful like thyroid.
Okay.
And then the other thing, if someone has like high thyroid or hyperthyroid symptoms, so kind of more on the opposite side, like constant weight loss, diarrhea, hair loss, oily skin, like high blood pressure, then like things like lemon balm or like bugle bee are good for that. And then just in turn, like iodine containing herbs like iris, versicolor, or kelp.
Okay. So what I'm understanding is step number 1, you do the testing. Guys, anyone has any questions, you're welcome to put it in the comment box. I saw some requests. Some people want to join. We haven't figured that out, how the third person can join right now. I don't know how that works, so I apologize for that. But you can ask questions. So first thing is the testing, like she said, TSH, T3, T4, food sensitivity. 4 tests that I can at least name. Then once they figured that out, they designed the diet, taking the inflammatory foods out, putting the right foods in. Then the lifestyle, right? Dr. Suhani, you talked about the stress, releasing of the stress, which all of us are stressed out. And the 4th thing is supplementing it with herbs. Anything else you would like to add?
Yeah, so just with herbs, we also do like minerals and vitamins kind of thing. So even just looking at making sure vitamin D stores are optimized. Zinc, copper, selenium, tyrosine, iodine are other like minerals like good for the thyroid too. So again, there's foods rich in those minerals, but also sometimes people just need more therapeutic doses and supplement form.
Okay, so zinc, selenium, iodine, either eating foods that are rich in these 3 minerals, or supplementing it with some kind of a supplements, whether it's a powder format or whatever. I'm not in like a capsule that you would recommend to supplement the selenium, right? Selenium, iodine, and what was the third one? I forget.
Selenium, iodine, copper, and zinc.
Copper and zinc. Okay, 4. Okay.
Yeah.
All right. So all this combination, you put the whole package together. And then now the approximately, let's say on a hypothetical, if someone is following your guidelines, like they're doing the stress reduction, they're following the diet, they're following the supplements, how much time does it take for them to really come back to the normalcy? Like, are we talking 3 to 6 months, or 6 to 9 months, or 9 to 12 months, or is it a lifelong kind of a thing they have to do?
So usually with hormone balance, I usually say at least 3 months, because it kind of takes about 3 months to get hormones in balance. If you're looking at more of an autoimmune thyroid picture, whether it's that inflammation, it can take a lot longer to bring down the thyroid antibodies. But again, that's where we kind of really need to look at more like digestive, like what's going on digestively, like liver detox, making sure that's functioning optimally. Like heavy metals sometimes can interfere with thyroid.
So there's a lot of other things like heavy metal detox, other detox. So you just want flushing, the toxins out of the body, right? That's basically in a very simple way. Okay, well, this is very helpful and useful. Anything else you'd like to add before we wrap up, Dr. Suhani?
No, I think that's good. Like if anyone has any questions, they can always send me a direct message too.
Absolutely, absolutely. Yeah, if anyone has any questions, we are talking about thyroid testing. I see people joining, at different times. If you have any questions, we have Dr. Suhani Shah. You can just put it in the comments right now, or you can even put it in the comments after, after the session is over. There's no problem. We just want to educate all of you, how you can help balance your thyroid issues. The topic is thyroid, and please help share our sessions. We are bringing a lot of sessions every day. We thank you for your support. With that, I'd like to wrap up. Thank you so much. Thank you, Dr. Suhani, for being here.
Thank you.
Thank you. Bye-bye.
Bye.